Welcome to my podcast. Today I'm going to talk about another case which can be found as well. So basically, after you introduce yourself, as we always agreed, and double check the patient name, date of birth, we'll ask the patient, how can I help you today? It's usually a young male who will present with a small, red, very itchy area. Could be in the extremity, mostly in the lower legs, could be in the buttock, on the trunk. And the patient will have this intolerable, intense, itchy skin lesion, which could be a red spot and then start to develop into wavy red line or track that will progress in few weeks' time. And you just start to ask the patient, can you tell me more about it? So the patient will say, just noticed this rich, itchy lesion, and I don't know why is that. It's just progressing. Some patient, they might be knowledgeable. I remember someone had sent me a photo, and he was thinking about the diagnosis on Will Spot, and he diagnosed himself. And this characteristic skin lesion you can't even miss because it's very characteristic and distinctive. So you will ask the patient, do you have any more issue that you need to tell me? Anything that you think could be related to this? So you always need to explore the thoughts and idea of the patient. If they have any thoughts that might be the reason for their presentation. You will ask if there is anything that could increase or lessen the symptom. Say, for instance, if a patient had applied something that to alleviate the itching or to treat it by OTC, and ask if there is any associated symptom at all, if there is fever, if there is vomiting, if feeling unwell, all sorts of this. And you will ask if there is any past medical history that you should be aware of, if the patient taking any medication the long run, if there is no allergy at all, and if he had any history of similar thing before, if there is any family member had the same issue. And then you just probe on the lifestyle if the patient, for instance, is active and fit, regard the eating habit also. If the patient is a smoker, also if he's drinking. So just need to touch upon this lightly according to the situation. And then you will ask, as I say, the patient is young, so you'll ask if there is any travel history recently, and if there is, if the patient is sexually active, is engaged with a partner, or regular partner, or multiple partner, or the patient, if he traveled abroad and has a casual intercourse, if it's protected or unprotected. So you just need to ask all of that. And then you will ask the patient that I would love to have a look just to see what sort of lesion is that. And we just see that distinctive red wavy lesion. So the patient in the lab too, they will just show you a picture of the skin lesion. And this is very distinctive whereby you can't even miss it. So you will have a diagnosis in your mind. So basically you will think of contact dermatitis, if the patient had any contact with anything that could be related cause of this skin lesion. And mostly if it's blistering, you will think about another common condition, which can be also unilateral, so it's only one side being affected, which is called cutaneous larva migraine. And this condition usually happen in the tropical area or subtropical area like Caribbean, areas in Australia and certain area in Africa as well. So you just ask the patient, have you been abroad so anywhere? The patient might say, I've been to Thailand, been Caribbean, all sorts of things. And then you will ask the patient, what did you do exactly? So the patient might say, I was enjoying the sun in the beach, I was walking there. So this will give you an idea what could be the lesion and what could be the diagnosis moving forward. You will explain to the patient that firstly, this is a very intense condition, but it's going to last for some time, like 4 to 6 or 8 weeks, because usually the migrating larva will die in 6 weeks' time. However, in certain conditions, it might persist for a few months' time. And it's related basically to the animals, which is basically cats and dogs, hookworm, if they have infected larvae, which harbor their digestive system, and then with the defecation, the poo, it just go out. And usually the patient might walk in those kind of areas whereby it's infected, and this will cause, of course, the penetration of the larva through the skin, and this will cause intense itching and soreness of the area. So you just tell the patient about all of that. You will say it's self-limiting, so the patient should, by 8 weeks, feel a relief and improvement. So you wouldn't leave the patient like that. You'll just give antihistamine, like cetirizine or lortadine, 10 milligram SOS. You will give also topical steroid to alleviate the symptom. If the patient been scratching a lot and there is sign symptom of infection, you will treat, of course, with antibiotic. And you will give a topical tapindazole or antihelminth treatment in the form of mebendazole, ivermectin, which also used in scabies as a single dose. And you will give some precaution to the patient that they need to avoid in the future walking barefoot. Always try to wear your shoe, especially in the sand area or the soil area. Even like in the dry sand, it doesn't mean that you're protected, even with a towel. So you need to have a protective thing when you want to enjoy the sun in any of those areas, as I mentioned, tropical and subtropical. And you just red flag the patient if you didn't feel any better, or you're not improving, or you're not feeling well in yourself. You need to come back immediately and contact us or go to the A&E. So by that, I hope that I covered another important case. Can be seen as well. It could be a challenge if you have it in BLAB 2. So by this, you will gain a lot of scores because you try to explore what might be the differential and how can you diagnose by the distinctive skin lesion. And I see you on another podcast. Thank you.